And really, this diagram looks at coronary heart disease progression over decades in time. And this is a vessel, the wall of the vessel, blood going through the vessel, but the development of plaque in the wall of the vessel over time, seeing how in early stage it's mild. As the plaque progresses in the vessel wall, it actually begins to stay there. And it's actually the rupture of this plaque that is the inciting event to close this pipe down and cause a heart attack if this is the artery going to your heart. Alternatively, if this is the artery going to your brain, we call it a stroke. So what you see here is age is a predictor of risk, but also your inherited risk. But these are some of the attributable risk factors over time. Smoking, high blood pressure, elevated cholesterol, diabetes, inactivity, and obesity put you at risk for the development of this over time. So really, the reality is being premenopausal probably does not protect you from cardiovascular disease, and you should be vigilant about your risk at all ages. Plaque calcifies in the wall of the vessel, and this can actually be identified with a CT scan. CAT scans can actually pick up the presence of calcium in the vessel wall, and when the plaque's been there long enough, it starts to calcify. So cholesterol is a number to know, but the vessel wall is where the risk is. This series of pictures depicts the identification of calcium in the wall of vessels to your heart. And what you see here in these specules of calcium that can be picked up by the CAT scan on several planes here, and we look at how much calcium over time. So here's years to an event, and here's calcium score. And what you see here is as your calcium score increases, your event rate increases. So consider getting a calcium score. It'll tell you whether you're sitting there growing plaque or not, and that's the disease that we're trying to slow down. Again, calcium scoring is a CAT scan, it's a test, can tell you whether you're sitting there growing plaque or not.